Okay, yeah. So my first question, what is the situation with the pulmonary hypertension in Europe?
Yeah, as you might know, pulmonary hypertension is a rare respiratory, in other terms, lung diseases. It impacts not lots of patients all around Europe. However, it is a severe disease, which means that we need to raise awareness of this disease in order for each patient to get early diagnosis.
What about the financial funds? Do these patients get some financial aid from the state?
I do not know whether you are aware of the situation of pulmonary hypertension Europe, PHA Europe, because it's an umbrella association. It means that we do not have private individual members, but members from almost each and all countries all over the Europe. We have members from Norway to Italy, from Ireland to Ukraine, and from Belarus to Portugal. It means that we have patient association. Our main goal is to make these associations strong enough to help the patients they have within their respective countries.
So what is the aim of this association?
We have a mission statement. If you visit our webpage or see any of our materials, you can see our mission statement within our logo. We have four main pillars. One of is early diagnosis. It's crucial for us. It's crucial for the patients because if they get the appropriate diagnosis as well as the treatment, it means that their life is saved. So this is the first, early diagnosis. The second one is the best possible treatment. We are fighting for this in terms of different advocacy activities within the European Union and beyond that. The third one is better quality of life. It means that we are struggling for finding lots of possibilities and solutions for our patients to help them in their everyday life. And our big dream is to find cure for this disease. Currently, we have lots of different type of treatments available for the patients, but it does not mean that they are cured from this disease. So these are the four main pillars, and this is our mission.
So you work with patients from different countries, yes?
Yes, you are right. As I mentioned, we have connections with lots of patients from different countries, but these connections are not direct. It means that we have connections with the patient's leader from each and all association, and they are cascading down the information we can provide with them, and also we are involving them in lots of different types of projects. We have a strong advocacy department within PHA Europe. Also, we have a capacity building program which helps the association being stronger so they can represent their patients in their respective countries in a better way.
What do you think, in which country that you work with, patients get best financial aid or best help?
You know, it's always a difficult question because once you make and actually get in contact with countries from the Western Europe, for instance, from the Benelux countries or Norway or Sweden, it is out of question that they have everything. So there are a huge scale from the maximum available financial support or aid which patients are receiving, and we have Eastern countries and Central European countries. I'm from Hungary, so we are in the middle, I think. And for instance, we can mention Moldova. They do not even have a healthcare system which can provide them PH experts to manage the disease of these patients. So there's big differences between countries. Naturally, the golden standard is Switzerland and Norway and these very rich countries, but they have ample of funds for everything, not only for pulmonary hypertension patients, but for other activities, charities as well.
What about Ukraine? Patients in Ukraine, do you know about the support of them here?
Yeah, actually, last year also this year we worked a little bit with both of the Ukraine Patient Association. As far as we know, there's a new approach regarding the health technology assessment, which means that they are, the payers are trying to find out what type of medication they can provide within their funds capacity, because as far as we were informed, you do not have enough funds to provide all different type of medications, because for pulmonary hypertension we have so-called different pathways, which means that you as a patient can receive different type of medications for your disease. Once diagnosis is made, the patients are undergone a risk assessment, which means what type of risk they facing regarding this disease, and based on that and other factors, you receive the appropriate medications. There are guidelines based on which the physicians are trying to find out the best treatment. And on the other hand, they need to take into consideration the fund restrictions of the respective countries. So based on these type of factors, they need to determine what type of medication they need to receive. And currently, as we were informed, in Ukraine, they are checking the possibilities how it is possible for the patients to receive the most appropriate medication, and also at the same time to provide medication for most of the patients.
What do you think is the main gap in treatment of this disease in Ukraine?
I think it's a multi-factor question, and from outside of the country, it is quite difficult to assess the current situation. As far as we know, there are different layers of decision-making bodies, which means that if you are located in a different district or a different part of the country, it may occur that different rules apply. So it is a very difficult advocacy situation, as far as we were informed in Ukraine, to determine what type of decision should be made. Naturally, there are priorities in the politicians' head, what type of cause they are determined, or what type of situation they would like to help in. So they think there are lots of work in Ukraine, how you can actually make the best possible situation for the patients. And according to our best knowledge, we are trying to help you in this situation. And of course, what an umbrella association can really help you is to provide best practices from other countries, provide you examples how it works in other countries in such kind of difficult situations.
Thank you for the talk.
You are very welcome.
Yeah, bye.
Thank you, bye-bye.
Друзі, я ж не знала, що питати тобі.